hospital admissions is now every 18 days. Over the past fortnight, it's fallen from those aged over 85 years of age from 18 days to 15. This morning, the Office for National Statistics published data showing the number of deaths falling by over a quarter a week in mid-February. And more than that, the number of deaths each day is not only falling faster than after the first peak, it's falling faster in the over 80s who got the jab first compared to the under 80s. The number of daily deaths is halving every 12 days, but amongst the over 80s, it's now halving every 10. So while the fall in cases is decelerating, the fall in the number of deaths is accelerating. And Mr. Speaker, what all this shows is that the vaccine is working, reducing the number of deaths among those who were vaccinated first and preventing hospital admissions. This is real-world evidence that the vaccine is protecting the NHS and saving lives, that the 12-week dosing regime is saving lives, and that this country's strategy is working. Mr. Speaker, as well as this real-world data, I'd like to update the House on two new pieces of analytical research published over the last 24 hours. First, this morning, the Office for National Statistics published new data on the levels of protection people have. They show that up to the 11th of February, 1 in 4 people are estimated to have antibodies against coronavirus in England, up from 1 in 5. The levels are highest in the over 80s, the first group to be vaccinated, showing again the protection from the vaccine across the country. The second piece of research, published last night, shows that a single dose of either the Oxford or Pfizer vaccine delivers protection against severe infection in the over 70s, with a more than 80% reduction in hospitalisations. It is great news that both vaccines work so effectively. And in fact, the protection from catching COVID 35 days after the first jab is even slightly better for the Oxford jab than for Pfizer. So people can have confidence that they will get protection whichever jab they're offered. I'm very grateful to the work of colleagues across the House for promoting vaccine take-up, which has helped deliver some of the highest levels of enthusiasm for vaccination in the whole world. And I'm pleased to inform the House that we're now inviting over 60s to be vaccinated too. Although the day-to-day figures of supply are lumpy, we have some bumper weeks ahead later this month. But given that our vaccination programme began 12 weeks ago today, from now we begin in earnest our programme of second vaccinations, which ramps up over the month of March. I can assure the House that we have factored these second jabs into our supply projections, and we're on track to meet our target of offering a vaccine to all priority groups 1 to 9 by the 15th of April and all adults by the end of July. Mr. Speaker, our vaccination programme means we can set out our roadmap to freedom and put this pandemic behind us. But we must stay vigilant, because COVID-19, like all viruses, mutates over time. And part of controlling any virus is responding to new variants as they arise, just as we do with flu each year. Knowing this, we invested in genomic sequencing right at the start of the pandemic, giving the UK one of the biggest genomic sequencing capabilities in the world. And thanks to that, we've been able to spot variants here at home and support others to detect variants in other parts of the world. I'd like to update the House on the 6 cases of the variant of concern that was first identified in Manaus in Brazil that we've now identified here in the UK. We know that 5 of these 6 people quarantined at home as they were legally required to do. We've been in contact with them, and I'd like to put on the record my gratitude to them for doing their duty and following the rules. Whenever we identify cases of a new variant, we respond fast and come down hard by bringing in enhanced sequencing and testing. And so we're stepping up our testing and sequencing in South Gloucestershire as a precaution. We have no information to suggest that the variant has spread further. Mr. Speaker, unfortunately, one of these 6 cases completed a test but didn't successfully complete the contact details. Incidents like this are rare and only occur in around 0.1% of tests. I can update the House on the latest information in identifying this case. We've identified the batch of home test kits in question. Our search has narrowed from the whole country down to 379 households in the southeast of England, and we're contacting each one. We're grateful that a number of potential cases have come forward following the call that we put out over the weekend, and I'd like to thank colleagues from across the House who've helped us to get the message out there. And Mr. Speaker, our current vaccines have not yet been studied against this variant, and we're working to understand what impact it might have, but we do know that this variant has caused significant challenges in Brazil. So we're doing all we can to stop the spread of this new variant in the UK, to analyse its effects, and to develop an updated vaccine that works on all these variants of concern and protect the progress that we've made as a nation. Mr. Speaker, this country is on the road to recovery, and we have freedom on the horizon. We must proceed with caution, because although we're moving quickly, the virus moves quickly too. So let's not waver and do whatever it takes to keep this virus under control.
Shadow Secretary of State Jonathan Ashworth.
Thank you, Mr. Speaker, and as always I thank the Secretary of State for advance sight of his statement. With respect to the Brazilian variant, in January and February, cases here were running at tens of thousands a day. We were in lockdown. We're still in lockdown because of our own homegrown new infectious variant, and yet people were allowed to fly in from abroad, bringing the P1 Brazilian mutation with them. Throughout history, epidemic after epidemic has exploited international travel. Surely it is obvious that tougher border controls should have been in place sooner. I welcome the progress that the Secretary of State has made on identifying the batch, but can he tell us how on earth a test can be processed that doesn't collect the contact details, and what mechanisms will be put in place to fix this in the future? Because £22 billion has been allocated to this system. It feels to me that somebody has vanished into thin air. Can he assure us it won't happen again? I note he said there is no information to suggest wider spread of this variant, but he will recall John Edmonds from SAGE told the Home Affairs Select Committee back in January that for every identified South African variant, there were probably another 30 unidentified. Can he tell us if he has received any estimates on the number of unidentified cases that are in the wider community? Now, Mr. Speaker, I welcome the tremendous progress that has been made, both on vaccination and on driving infection rates down. It is a testament to the NHS and everybody involved in the vaccination programme, and a testament to everybody who is playing their part in this lockdown. But we also know that the virus can quickly rebound. We know that mutations could evade vaccination. We know we're in a race against evolution. So we have a long way to go, because nowhere, to be frank, is COVID safe until everywhere is COVID safe. And none of us want to yo-yo in and out of lockdowns. So can he guarantee that the lockdown easing will absolutely be based on data, not dates, as promised, and that the assessment time between each step isn't compromised? Now, I welcome the extra surge testing, but what is the current time frame for genetic sequencing? How can it be speeded up? Now, overall trends are coming down, that is welcome, but infections in some areas remain stubbornly high. The national average is 100 cases per 100,000. In Leicester, my city, it's one of the highest in the country though. Infection rate is 222 per 100,000. In Ashfield, the infection rate is 246 per 100,000. In Hyndburn, infection rates have increased to 162 per 100,000. In Oadby and Wigston, it's gone up. In Watford, it's gone up. In Worthing, it's gone up. So what steps will be taken to ensure that areas like Ashfield, Leicester, Watford, Worthing, Hyndburn, etc. aren't left behind when the national lockdown restrictions begin to lift? Or will they remain in localised lockdowns? Will the local authorities be given extra resources to do more door-to-door testing and retrospective tracing? And will workplaces in those areas be inspected by the Health and Safety Executive to ensure they are COVID secure? And of course, will people finally be given decent sick pay and isolation support? Now, many areas like Leicester are also facing a double whammy of relatively high infection rates and relatively low vaccination rates. So what further action will now be taken to drive up vaccination rates amongst hesitant communities? Will he fund faith groups, community groups, local public health teams to develop more targeted, tailored local vaccination campaigns? Which comes to tomorrow's budget. So tomorrow's budget can't be about the Chancellor's Instagram account. It has to be about the NHS and social care accounts. So can he guarantee that tomorrow we'll get an increase in the public health allocations to help public health teams plan their local COVID response over the next year? Will our NHS heroes get the pay rise they deserve? And with 224,000 patients waiting over 12 months for treatment, will our NHS get the resources it needs to deliver the patient care that patients and our constituents deserve?
Thank you very much, Mr. Speaker. Well, he's quite right to thank all those who are responsible for the vaccine rollout. It has been an absolutely remarkable effort, and he's right to say that the NHS have played their part, and they have played a central part. But it has been more than the NHS. It has also been the brilliance of the logistics, in particular of our armed services. It's been the volunteers who've come forward in their droves. It's been the regulator and the partnership with private industry. And I think this model of a combination of academic excellence and partnership between government, regulator and private industry is a model on which we can build. I know it's a model that they don't like much on the other side of this house. He says to me he likes it. We always knew that he's misplaced over there. His problem is that sometimes his rhetoric is aimed more at his backbenches than what he thinks is right up here. But I just urge him to listen to his own conscience, and to back us and back the businesses who are making this vaccination rollout happen, and to put that support into practice. He asked about sequencing, again done by a brilliant combination of academics, government and private businesses. We're now sequencing a third of the positive tests in this country, and that means that although that isn't yet a full survey of all the positives, although we're working towards that, it does mean that we are able to spot these variants much more than anywhere else in the world. We currently provide around 40% of the total global sequences of this disease, of this virus, and that is and we're driving up that sequencing capacity. He asked about increasing the uptake of vaccination. He's quite right to, and we are working with faith groups and local directors of public health and others, and councils have got a very important role to play alongside pharmacists and of course GPs in increasing the vaccination uptake. But the vaccination uptake has been very, very high, higher than I expected, and I'm really thrilled about that. He asked finally about making sure that the roadmap follows data, not dates. We have rigorously set out the gap between the steps to ensure that we can see the effect of one step before we take the other. That is with the goal of having this roadmap as a one-way route out of restrictions, so that we can all get back to the freedom that we crave.
We now go to the Chair of the Health Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker, and can I congratulate the Health Secretary on the brilliant progress of the vaccine rollout, which is a personal achievement for him as well as a collective achievement for the government. And also thank him for the transparency in that programme, and indeed transparency on the risks of the new Brazilian virus. I'd like to ask about transparency in another area, which is the new integrated care systems he's planning in his white paper. And the concerns expressed by the Nuffield Trust, the King's Fund, the Health Foundation, NHS providers at this morning's Health Select Committee about the lack of detail on just how the public will know how well their local ICS is doing. Sir Robert Francis told the committee that he favoured asking the CQC to Ofsted rate the new ICSs, and I just wonder whether he thinks that might be a solution to this accountability issue.
Thank you very much, Madam Deputy Speaker. And transparency has played a vital role in our approach to responding to this virus, and I think that is an important lesson from it that should be heeded globally. I think that in terms of the future of the NHS arranged around the ICSs, that transparency will be important too. There will be a crucial role for the CQC, which currently rates hospitals according to as he puts it, an Ofsted-style rating. And I think that it is vital that the CQC has a similar role when it comes to ICSs. And I look forward to working with him and other members of his select committee to make sure we get the details of that right.
Now I have video link to the SNP spokesperson, Dr. Philippa Whitford.
Thank you, Madam Deputy Speaker. While the number of cases with the Brazilian variant is thankfully small, it's a warning that being tested in advance doesn't rule out being a traveller who's carrying COVID. The South African variant is resistant to antibodies from previous COVID patients, and there's concern that both may be resistant to vaccine-induced immunity. They could therefore undermine the success of the vaccination programme. The Brazilian variant has already been identified outside South America, and the South African strain is present in 35 countries that aren't on the red list. The arrival of this Brazilian strain via both Switzerland and Paris demonstrates the various routes to the UK from high-risk countries, and how a traveller could avoid the current hotel quarantine system by separating out the legs of their journey. Those infected spent several hours in close quarters with other travellers who even now would not be subject to hotel quarantine. I assume the government is tracing the passengers from these flights, but with genomics taking some time, there is a significant window for concerning variants to get a foothold in the UK before they're discovered. This situation wouldn't have arisen with comprehensive hotel quarantine as advised by SAGE. So why did the Secretary of State agree to such an inadequate system? And can he tell us the view of the Joint Biosecurity Committee? Does he recognise that quarantining just 1% of international arrivals does not protect the UK from these variants, nor those which may evolve in the future in other parts of the world? So will the government now review their hotel quarantine policy and make it fit for purpose?
Madam Deputy Speaker, the Honourable Lady is completely wrong and she knows it. There is a quarantine in place for 100% of arrivals as passengers in this country, and in fact this episode in which all those we've successfully contacted, all 5, have fully isolated and quarantined at home as required, demonstrates that policy working. Now, we have further strengthened it and introduced hotel quarantine, and that will no doubt give further reassurance. But the characterisation that she gives out is wrong, and some of the description of the organisations involved is wrong as well. I'm very happy to ensure she gets a private briefing so that she can understand the situation in future.
Now I have a video link to Pauline Latham.
Thank you, Madam Deputy Speaker. Could I congratulate my right honourable friend for the rollout of the vaccine and for the use of the sure screen tests which are brought local to me. The pressure on the NHS due to coronavirus has caused the cancellation of thousands of elective operations. Can my right honourable friend inform me what plans he has to ensure that hospitals catch up on cancer diagnosis and care and cardiothoracic diagnosis and surgeries, and how fast he expects to progress this?
Thank you very much. My honourable friend makes 2 critical points. The first is that the manufacture and the purchasing of British-made tests is an incredibly important project. And I want to thank SureScreen in her constituency, who have worked very closely with us over a number of months to get a product that we can all be very, very proud of, made in Britain, to test people in Britain to help break the chains of transmission and control this virus. And I'm very grateful for her personal work in that regard. I also agree on the importance of the second point that she makes. In the spending review, £1 billion was put aside for the recovery of elective operations, as well as £500 million for recovery of mental health services. And this is absolutely crucial in cancer and all of the different elective areas, including cardiothoracic, as she set out. We'll be publishing further details of this recovery programme soon. At the moment, the NHS is just exiting a stage of very, very significant pressure. There are still over 10,000 people in hospitals with COVID, so there's still significant pressure, and we need to make sure that the staff and the team get some R&R, but then the next year will be all about that recovery that she talks about. The money's been allocated, and then we need to get on with it.
We now go to the Chair of the Home Affairs Select Committee, Yvette Cooper.
Thank you, Madam Deputy Speaker. The Brazil variant cases arrived a month after I raised this issue with the Prime Minister, and they show the problems from delays, but also the limitations of the pre-travel tests that didn't catch these cases. Even now, 99% of the 15,000 daily arrivals are not covered by hotel quarantine, and most people can still travel home from the airport by tube, train or even plane, mixing with others, as some of these travellers did, without being tested on arrival in the UK. So why is the government still refusing to introduce additional tests on arrival and still allowing international passengers to travel onwards on UK public transport? Does he not recognise that these gaps in the system will let more new variant cases spread?
These cases would be caught by the new hotel quarantine policy. When she talks about the need for more testing, we've introduced tests on day 2 and day 8 to make sure that we can keep everybody who arrives as a passenger into the UK under the necessary level of surveillance.
Video link to Bob Blackman.
Thank you very much, Madam Deputy Speaker. My right honourable friend will be well aware that my constituency is an extremely diverse constituency in terms of its racial and religious makeup. And also our National Health Service staff have done a brilliant job on keeping up the fantastic vaccination rate during this period. However, we are still having to combat the anti-vax type propaganda that's going out. So what action is my right honourable friend going to take to ensure that people get the truth about the wisdom of taking the vaccine, regardless of what race, religion or of cultural background you come from?
Madam Deputy Speaker, it's an incredibly important question, and I pay tribute to the work that my honourable friend has done in getting this message out there. And in Harrow, we're vaccinating in mosques, we're vaccinating in temples, we're vaccinating in GP surgeries, and it is a critical part of the rollout to ensure the message gets to everybody that this vaccine is safe and it works. And it's no good just me saying that, but we want to and we are engaging leaders of all communities, faith leaders, of people who have strong voices in their communities, and critically ensuring that people feel as much as possible that the vaccination effort is accessible to them. It is on us to make sure that the vaccines are easy to get hold of and that people get answers to any reasonable questions that they may have. And I look forward to working with him further on delivering this across Harrow and the whole of the country.
Video link to Munira Wilson.
Thank you very much, Madam Deputy Speaker. I'm sure the Secretary of State will agree with me that every hour is vital in tracking down new positive cases, particularly new cases of new variants. So could the Secretary of State explain why it is that the eye-watering £22 billion that has been spent on the test and trace system, but it doesn't track each and every test that is sent out based on the unique code on every test? Surely this would help close in the net on positive tests much quicker than the public calls for help we've seen over the last few days when that vital information is missing when each test is returned.
Madam Deputy Speaker, I'm not sure you were in the chair when I addressed this precise question in my statement, this not having the contact details happens in about 0.1% of tests. In this case, we think that the test was done as part of a home test kit, where obviously it is incumbent on the individual to set out those details, because home test kit can be both sent to your home, in which case of course we have the details of where it was sent, or in response to surges they can be taken round by the local authority teams and dropped off. And therefore, we need to find out exactly where this one was dropped off. But as what she omitted to say is that the team have done a very, very good job of narrowing down to 379 households where this may be. The call out at the weekend has been answered with a number of leads. And we're working hard to make sure that we can find the individual concerned.
Video link to Aaron Bell.
Thank you, Madam Deputy Speaker, and could I welcome my right honourable friend's statement, both the scientific news and the progress of our vaccine rollout that suggests we're well on the way to getting back to normal. In particular, I was delighted to learn about the fantastic new data showing both the Oxford and Pfizer vaccines are effective in hugely reducing hospitalisations and deaths from COVID. And indeed that the Oxford jab, which is being manufactured here in Newcastle-under-Lyme, may even be the more effective of the two. So will my right honourable friend join me in welcoming that our European neighbours, like France, have recognised this fact and are moving to now allow this terrific vaccine to protect the lives of older people there, just as it has done in the UK?
Secretary of State.
Yes, Madam Deputy Speaker. I'm delighted to see any country recognise the life-saving value of the Oxford AstraZeneca vaccine, as we recognise the life-saving value of all that have passed assessment by our regulator, the MHRA. And this vaccine, we know, is not only safe, but it is saving lives and stopping hospitalisations right across this country right now. And I pay tribute to the scientists behind it who have done so much work to get it to this place. And it is simply fantastic to see in the data with the naked eye that these vaccines are saving lives.
Video link, Ian Paisley.
Thank you, Madam Deputy Speaker. And can I also congratulate the Secretary of State for having the temerity and the leadership to identify early on that the vaccination and getting a good vaccine was the way ahead. And here we are, very much leading the way for not only Europe, but indeed for the world. And indeed, a few weeks ago, the Irish government themselves and Europe tried to actually steal vaccines out of the arms of people in Northern Ireland because they were so jealous of how good the United Kingdom was doing. With that in mind, can the Secretary of State let us know what he's going to do whenever, by probably late summer, we've got 8 times the amount of vaccines the United Kingdom will actually need? Is there a list being compiled of those needy countries where the United Kingdom can help and assist those people in those countries with vaccination?
Secretary of State.
Yes, absolutely. Madam Deputy Speaker, whilst I am so proud of the work that we've done in this UK, in this United Kingdom, to both develop the Oxford AstraZeneca vaccine and also to buy vaccines from around the world that are safe and effective and be able to vaccinate everybody here at home. I'm also absolutely cognizant of the fact that vaccination around the world will be necessary. I was very pleased to see that COVAX has started vaccinated in Ghana last week. And while we do currently look as if we may have excess vaccines in the future, we have clearly committed that we will make them available around the world. Now, we know for sure that we seek to vaccinate with 2 doses every adult in the UK. There may well be a need for a 3rd vaccination over the autumn against variants, and there is currently a clinical trial considering the vaccination of under 18s. So the exact number of vaccines that we will need for the UK population is not yet known, but we are absolutely keen to ensure that we then go on to support with vaccines, as well as with money that we have already pledged, support the vaccination of the